रहते हैं जनरली 3 और 4 साइज़ के रहते हैं. दिस इज़ 4 एंड दिस इज़, इसका अजीब सा एक शेप है, इट इज़ नंबर 5. इसका एक लंबा वर्जन है नंबर 7, लेकिन इसका जो टिप का प्रोफाइल है इट इज़ कॉल्ड नंबर 3, है ना. तो 3 नंबर ब्लेड का जो प्रोफाइल है और 4 नंबर ब्लेड का जो प्रोफाइल है, दीज टू हैव डिफरेंट प्रोफाइल्स. यू कैन सी 3 नंबर ब्लेड का प्रोफाइल हैज़ अ नैरो स्लेंडर प्रोफाइल, है ना. नंबर 4 ब्लेड हैज़ थिकर प्रोफाइल. तो दीज टू BP हैंडल्स होल्ड टू डिफरेंट टाइप्स ऑफ ब्लेड्स, है ना. इसमें 4 नंबर में यू कैन माउंट 22, 23, 20 एंड हायर ऑफ ब्लेड नंबर्स. नंबर 3 में यू कैन माउंट 11, 12, 15, नंबर 10 blades. How should you mount the blade? है ना. It should be achromatic. Give me a fresh blade. Give me a fresh blade. Suppose I am mounting this blade onto this BP handle, है ना. This is a 21, 22. This is 23, है ना. This is 23 blade. And how should you mount it? You should hold this BP handle like this and keep it in slightly oblique. Then engage in the slot and then gently twist and push. You'll hear a click. And never remove it with your hand, otherwise it will fly out. How should you remove it? You should not remove it like this. Suppose we have mounted it holding on the against the edge. This is the edge of the blade and you are holding against the edge of the blade. Now put a lock, gently wiggle it, twist it and you will hear a click. How should you unmount it? You grab here, lock your instrument and gently push with your thumb. This is the most achromatic way. The blade will not break, it will not fly away. And as soon as you have dismounted it, discard it in a sharps bin. Similarly, suppose you have taken an 11 blade. This is the most dangerous blade of all. This has the sharpest point at the edge. Use it for stabbing. Similarly, while you are mounting on this needle on this BP handle, again engage in the groove, gently twist and push. It will click. And similarly, if you want to dismount it, grab it, gently lift it up and push with your thumb. Not pull like this, and it will fly away and injure someone else. Discard it into the sharps container. So there goes the BP or Bart Parker handle. After that, you have to retract the skin. For that we use this dissecting forceps. These are called tooth dissecting forceps. You can easily see that there is a tooth at the edge of it. One has 2, one has 1. It fits perfectly when the jaws are closed. And its counterpart is the non-tooth type of forceps. Now, while closing the skin incision, you have to keep in mind the staff nurse has to pass the tooth forceps. It is counterintuitive. You might think that holding the skin with a non-tooth forceps will injure the skin less, but it is actually on the other way around. To hold the skin with same sense of surety, it takes 5 times more pressure on the non-tooth forceps than to use a tooth forceps. So it is counterintuitive to hold the skin with a non-tooth forceps. It actually injures the skin more rather than hold it with a tooth forceps. Okay. While closing the skin, pass the surgeon with a tooth forceps. Now, how should you pass the instrument to a surgeon? How should you pass your scalpel? You should always pass the scalpel in your kidney tray. That you all know. You should never pass any mounted sharp with your bare hand. And suppose in dire emergency you have to pass with your bare hand, there is only one technique to pass it. You should always pass to your surgeon in this kidney tray. Always. Never pass it by hand. Never stab the surgeon himself. उसने scalpel मांगा, उसी को stab कर दिया. This is not the way. And in case of dire emergency, अगर if it is filled with blood, आप discard नहीं कर पा रहे हो, then the only way is to supply it like this. See, my hand is like this. Even it jerks, I will not injure myself. And if it pulls, he can easily pull the knife out. Even if he pushes, it will not hit me. And this is not the way to pass a scalpel. This should never be done unless it is a dire emergency case. It is already filled with blood. You have just opened the scalpel. The patient is a non-responder. you are passing the instrument. The first thing, obviously scalpel will be the first thing. You should always try to pass it on a metal tray. If it is not possible, this is another alternative. Keep the tip away from your palm. Do not flex your hand like this. Keep your hand straight and supply it like this. Surgeon, this is your scalpel. And for all the surgeons, use हो गया मतलब you have no right to discard the scalpel like a toy. It is the sharpest instrument on your table. You have the responsibility of you, your patient, and all the staff nurses. It is your responsibility to discard all your sharps respectfully and safely. Whenever you want to discard, even if you are in a hurry, always discard the sharp peacefully. Scalpel incision हो गया. We know even in damage control laparotomy you have to put 3 quick rapid strokes, but after that ask for a bin, ask for a kidney tray, or say it clearly, loudly, take back the knife, take back the scalpel. And you should all be careful about it. The first step is extremely important. This is the most important step for any of you can get injured. Any of us can get injured. And all our non-responder patients do not have any viral markers. And always pay good respect to the sharpest instrument in your tray. Now after that it is already done. So we have told how the non-tooth instruments actually takes more pressure and injures the skin more. These are the dissecting forceps. Then these are our hemostats that might need during dissection. The shortest length of the hemostat, it is called a mosquito, or it is called as a Halsted artery forceps. Halsted, William Halsted, इनके नाम से दिया गया था ना. Halsted artery forceps is a very peculiar mosquito-like sting and a very fine profile on the tip. Suppose a mosquito is sitting on your skin. How will it look like from the side? It will look like it is sucking on your skin with the tip piercing the skin like this. It is very uncanny how did this instrument get the name of a mosquito, but it is the best explanation we can provide. This is why it is called mosquito. It is called a Halsted artery forceps, or better called as mosquito. Another type of artery curved hemostat dissecting forceps is this curved hemostat, medium sized curved hemostat. It has various names: trials, Spencer Wells, Pian forceps, depending on what is the profile of the serrations and how much are the serrations, what is the direction of the serrations. Generally in our curved hemostats, it has a box joint, a small shaft, a ratchet, 2 eyes, and blades that are curved, and the serrations in our curved hemostat are always transverse. Generally the curved hemostats that we use. There are few special varieties of curved hemostat where half of the jaw is plain, half of them has serrations. And there are some curved hemostats which has longitudinal serrations also, particularly in right angle. Now look at this instrument. This is the larger this is the larger straight hemostat, and look at the profile of the jaw. It has some serrations in the anterior part and no serrations at the back. It may be used to hold the sutures. It can slide through this part, but this part is used to hold the tissue. But another variant of this instrument has got 2 teeth in front. These are called cockers. See, this is a cocker. This is a Cocker's hemostat. Emil Theodor Cocker devised this instrument, where it is used to hold the tough structures like galea, to hold the tough structures like facial structures, or it is still used in gynecological surgeries to clamp the umbilical cord. Now there is another instrument. It is called a right angle. The right angles or Mixter's right angle forceps. There are 2 types of right angle. One is called a Mixter right angle, one is called a Leahy's right angle. Leahy's right angles has longitudinal serrations. In one set, in only particular one set, we would have a Leahy's right angle. But most of the times we use a Mixter's right angle. Mixter's right angle has a sharp acute curve with narrow slender profile of the tip. It is a box joint and the serrations are transverse. It is very useful to dissect beneath a tubular structure, around a tubular structure, and then you can easily use it to hook around and clear a space. Now how you should feed the suture to a surgeon's right angle. It is very important skill to develop, and it is very important skill for the surgeon also how to retrieve that suture. Okay, now consider this as a tough structure. is a tubular structure and we have to dissect around it. Okay. Then the surgeon should dissect along the length of the tubular structures, not across. Okay, along the length of the tubular structures. And then should he pick it up like this in a single go? No. He should go peek, open, come back. Then again go, open up and then come back, and then finally he should go and displace the jaws of this instrument. And after that should keep the jaw open. And in between that you should pass your suture. How you should pass your suture? Now suppose in this case he is operating at the depth of it, and you should always load the suture like the string of a bow. Suppose this is the first part of the bow, this is the stem of the bow. Then how should you load the string? You should load like this. A little bit of tail is just protruding in front. How will it help? The little bit of tail will help. Suppose the wound is at very depth, then you cannot cross the tip across this. You have to feed this. But if it is a superficial wound and the surgeon has already dissected the longitudinal structures and he is asking for the thread, you should always load like this with the curvature of the instrument. Keep a little bit protruding from the tip and feed like this. And then whenever he grabs it, be ready to unclamp it. Don't stand still there. The most hindrances happens when you just feed and stand still. Now the surgeon wants to retrieve the thread, but you have not unlocked your instrument. What will it do? It will lacerate the sutures. It will lacerate the structures. Okay, I am showing it again. Firstly, there are two lessons for surgeons also